Hey there everyone, it's Dr. Steve here again from Elevate Sport and Spine in Denver. I wanted to make a video to talk today about knee pain and why you might have it, just based on some of the habits you have when you move, particularly when doing things like taking a step up or doing lunges or squatting. So just to jump right into it, I have put a piece of this kinesio tape here on my knee to show how the patellar tendon gets kind of stretched out depending on how my knee moves, and that is one of the things that tends to lead to particularly anterior or front knee pain here, either on top or below the patella or your kneecap. So what we can do to kind of control this is look at how kind of far out my knee goes over my toe when I'm doing things like stepping up, lunging, or squatting. So I'll show you here with the tape what it is that I'm looking for. I've kind of marked it up so we can have kind of a visualization of what the patellar tendon kind of looks like underneath there. Kind of attaches to the top of the kneecap here, and then underneath it attaches this kind of knobby bone on my shin. From there, I put some kind of hash marks in the middle so that we can see just about how much they kind of stretch apart depending on how I'm moving. So typically when my patients have knee pain, I ask them to kind of show me what it looks like when they go upstairs, and most of the time, pardon me, what I see is that they have a tendency to kind of lean forward and push off with their quad. And what you may notice here as I do this, I'm going to really exaggerate it for you, is that this distance, particularly kind of between here and here, is much greater than it probably ought to be versus what I should be doing when I step up, which is to make contact with the step in about my midfoot, try to keep my knee from going out in front of my toe, and then pressing up using my hamstring and glute, as opposed to leaning forward into it and pressing off the front part of my toe and causing that big distortion there. So I hope you can kind of visualize the difference between those things. Again, this one, leaning forward into it, take a look at that gap that exists there before I come up onto the next step. Or what is the preference is to set kind of the weight more towards the middle of the foot and then press straight up from there. You should notice that this distance does not really significantly change a lot as I do that, and that should take some of the pressure off of this patellar tendon and my kneecap and keeping it from kind of grinding and pressing on the inside of that joint. From the side, what we're looking for again is that the knee does not really come out over the toe here coming to step up, versus what we're really looking for is more of a mid-foot kind of contact and then a press up using the hamstring and glute. For lunging, it's very similar, same idea. We just want to make sure that that toe, the knee is not coming out over that toe and that we're pressing out, versus what it would look like if I were doing it poorly, which is to lunge here like this and then step up out of there, pressing mostly out of my toes again. So those are a couple of quick tips. With squatting, it's the same idea, just making sure that we don't want to lean way out here like this. You need to try and get that weight back here, and that should take some of that pressure off there, kind of minimize that distance in between these hash marks like we talked about. I hope that helps you visualize a couple of things, maybe help you tweak your form a little bit, and hopefully get rid of some of that knee pain that you have. As always, if you have any questions or anything about this, how you might be able to improve it on your own, give me a call, shoot me an email, or talk to me at your next visit, and we can chat about it. Otherwise, have a great day. We'll talk to you next time. Take care. Bye.